Well, I think one of the take-home messages I got from this study actually comes from a subgroup analysis. So when we're thinking about metastatic hormone receptor-positive breast cancer, we realize it's a very heterogeneous group. A typical patient on Fulvestrant, on the FALCON trial, were patients with non-visceral disease. That is to say, they were presenting perhaps in an unscreened situation, an intact breast mass, a CT scan is done, and there are some bone metastases and perhaps some malignant lymphadenopathy. There, the advantage for Fulvestrant seems a little bit more dramatic, with about a median PFS of about 22 months, as opposed to Fulvestrant at about 14 or so months. So that's a much larger difference, and so these patients who are low risk of immediately running into health complications from their metastatic breast cancer, it would seem that Fulvestrant might be a good choice. But of course, when you use Fulvestrant first, it raises the question of what do you do upon progression, and at this point, that's a research question. The other thing that we still don't know is the overall survival data for using Fulvestrant up front. There's a hypothesis from an earlier, smaller, open label study that suggested that Fulvestrant could be associated with an overall survival advantage if used frontline, which is obviously intriguing, but that study wasn't big enough to be definitive. We'll know about the overall survival in about 18 months, 2 years, something like that, when the study is fully mature to read out for overall survival.